Us with some more information this morning is Dr. Randy Craven, Associate Professor of Ophthalmology at Johns Hopkins School of Medicine, who specializes in glaucoma. Good morning. Thanks for being here.
Good morning. That's always a mouthful, Lacey.
I know, it is a mouthful, especially this early in the morning.
Yeah.
So eye health, it's something that we need to focus on as well. Tell us the signs and symptoms when it comes to glaucoma. It's kind of a quiet thing that you don't really notice a lot about at first.
That's right, Lacey. You know, they call it the silent thief of sight.
Ooh.
And the reason for that is because you don't even know that you have it, and it comes along and slowly takes away your vision. Most of the time it's a very slow disease. Occasionally it can be fast, but most of the time it's slow.
Is there anything we can do in terms of prevention for eye health? There's so many things we can do for our body, but what about our eyes?
You know, the main thing, especially as we get a little bit older, is to, usually in your 40s or 50s especially, to start getting routine eye checks periodically.
Okay.
Doesn't necessarily have to be all the time, but every year or two is a good idea. And the doctors will pick up if there's something going on and help us with figuring out what to do for it at that point.
It's something you want to catch early too.
Absolutely, because if you catch it early, you can make a difference. It's a very controllable disease. It's somewhat analogous to diabetes. Once you find it, you can do things to help stabilize it. You can never make it go away totally, but you can certainly try to control it.
All right, so let's talk about what the treatment involves, or possibly even surgery.
Yes. You know, the treatments are what most of my patients struggle with, and the reason for that is because there's side effects or issues related to our treatments. Most commonly in the past we've used drops, and everybody knows how hard it is to sit back and try to put drops in their eyes.
It's tricky.
You know, you got to go to YouTube sometime and just watch what people do. But it's hard, you know, I mean, it's hard for people to put in those drops, and because of that, most people can't do it very well. And the average person is probably 80% able to put drops in. Some are really good about it, and some just don't do it at all.
It's bothersome, you know,
it's
a pain.
Yeah. Yeah, so if you can't do it, then we have to look at other options, or if the drops aren't working, then we look at some kind of a surgical procedure.
And let's talk about the CyPass.
Yeah. So, well, years ago, it's actually 10 years ago this last week, so it's my 10-year anniversary, I had the opportunity to put in a device that's a very small, what we call minimally invasive surgery. And it's a little stent that we put inside of the eye that helps shunt or bypass fluid. And it helps it, so what happens with glaucoma, as you can see from the graphic here, is that there's blockage of what we call the trabecular meshwork. And then after the fluid can't get out of the eye at that point, the next thing that happens is that we are able to put in this little shunt that bypasses fluid into a space that's not normally where fluid goes, but it helps it to get out of the eye in a better way. And this is one of the many different types of what we call minimally invasive surgeries, and you can find out about it at mycypass.com. So that's mycypass.com.
Incredible.
Yeah, and it's a new type of procedure, and there's many other what we call minimally invasive surgeries, and I've been involved with a lot of them.
Great.
One called the iStent and the Zen, and there's others, but they're all good for helping us have some other option.
Yeah.
Sometimes we still have to do traditional things because that's the better choice.
Okay, great information.
Great.
Thanks so much for joining us this morning. We
One
appreciate
last
it.
plug I would like to make, Lacey, to get a chance.
We can do it
For
quickly.
anybody that does have glaucoma, I would highly recommend that you take a look at the Wilmer Eye Institute. You can find this by just going online and Googling it. But it's just glaucoma, what every patient should know.
Okay.
My partner, Harry Quigley, wrote it, and it's helpful for anybody that has glaucoma.
Thank you so much. We appreciate it.